By show of hands, how many people out here have heard this statement? That today's children may not outlive their parents. It's pretty scary. And it's not that today's children aren't going to outlive their parents because of some epidemic disease that's going to come through the US. The issue here is chronic illness, right? Our children today are being diagnosed with chronic illnesses that used to take 30, 40, 50 years to develop, are now showing up in our offices at age 8, 10, 15. Could you imagine a generation of parents? These are my children on the screen. Could you imagine a generation of parents that are going to outlive their children? Put that thought aside for just a minute. Currently, life expectancy in the US is some of the highest that it's ever been. Centenarians in the US are one of the largest growing populations currently. And so the chances that my generation, my parents' generation, will live to see 80, 90, 100 plus is very, very high. Again, show of hands, if I can guarantee your quality of life is going to remain very high, how many here would love to see 100 years old? Of course. Keep your hands up. If I told you that your quality of life was going to stop around 65 to 68, that was the peak, and for the next 30 or 35 years, it's going to continue to rapidly decline, how many people still want to be 100? Right. Because ultimately, we want to live a long life, but not necessarily at the consequence of losing our quality of life. And the interesting thing is that's where we are right now. We're at a point in time where centenarians are one of the largest growing populations. At the same time, our quality of life index stops around 65 to 68. And so we're seeing that in the elderly right now, that their quality of life starts to decline around then and continues to decline as they age. And so the picture on the left is not what we see. It's the pictures on the right currently. And why is this happening? I'm going to say that the same reason that my children's generation may be the first to not outlive our parents is the exact same reason that my parents' generation, quality of life is peaking in their mid to late 60s and then declining for the rest of their years. The answer is chronic illness. And to me, that's a paradox in my practice, right? I'm a practicing physician. I treat children, I treat adults, I treat geriatrics. And in my patient population, in my own family, on one end of the spectrum is my kids who may have the shortest life expectancy in many hundreds of years. And on the other side are my parents who are going to have the longest life expectancy, but at the consequence of loss of quality of life. And what I'd like to talk about is how to deal with this chronic illness issue in our patients, in our own lives, in the lives of our family. You see, 45% of Americans currently have at least one chronic illness. And yet, according to CDC, according to the New England Journal of Medicine, just eliminating basic lifestyle changes, eliminating smoking, increasing your activity, eating a cleaner diet, dramatically changes the amount and the effect that these chronic illnesses will have on our life. In fact, 90% of type 2 diabetes is preventable. 80% of coronary artery disease is preventable. 70% of most cancers are preventable. And so it's not that we have this disease that we have no control over that's the reason that it's affecting our quality of life or the lifespan of our children. It's our lifestyle. It's chronic illness is a lifestyle illness. And if we can learn how to manage chronic illness, in fact, if we can learn how to manage our lifestyle, we could avoid all of these chronic illnesses, most of these chronic illnesses. And so if we want our children, my children's generation, to outlive us, and we want our generation and our parents' generation to start ratcheting up our quality of life index to match our longevity, we need to start understanding the connections between chronic illness and our lifestyle, between chronic illness and chronic stress. And we need to become doctors of cause, not just doctors of effects. We need to look deeper into where this chronic illness is stemming from and how we can affect it in our life. And that's the purpose of this entire conference, isn't it? And so I'm really happy to be here and to be able to share some thoughts with you guys. My name is Dr. Jason Saunders. I'm a chiropractor. I've been in practice for 14 years. We have a great practice in New Jersey. There are 8 chiropractors working. We each specialize in different niches, from neurology and pediatrics and prenatal and postpartum, musculoskeletal complaints. We also have nutrition and acupuncture and massage and counseling and exercise. And so what we're trying to do is we're trying to affect people in their life at that lifestyle level. We also do hyperbaric oxygen in our office. And that's the thing that we're here to talk to you guys about today. So the goal for today, the goal for my lecture today I want to talk a little bit more about chronic illness and chronic stress and lifestyle and what that means and how we start improving this in people's lives. And then we'll start talking about the mechanism of hyperbaric oxygen. How does it work? Why does it work? We'll get into some of the long and short-term effects of being exposed to a hyperbaric environment for periods of time. We'll start getting into more of the types of chambers that are available. Perhaps you want to get involved and have a chamber in your office, or you want to know if you're going to refer patients to get this type of therapy, what you should be looking for. So we'll talk about the different options and types of chambers that are available. And then we'll go into where does hyperbaric oxygen fit in the model of regenerative medicine, longevity, and healing. So let's get started. I said it before, we have to control chronic illness, and to control chronic illness, we're talking about lifestyle. And when we're talking about lifestyle, what we're really saying is we're saying chronic stress. Allow me to define what I mean when I say chronic stress. There are 2 types of stressors. If you have a pen and a paper, I suggest you write this down. There are 2 types of stressors: eustress, EU, stress, and distress. Stress is anything that causes a change inside of our body. There are positive stressors and negative stressors. So eustress are the positive, distress are the negative. Eustress build us up and make us stronger. Distress breaks us down and creates dis-ease, right? That's how we get sick. Of those 2 types, eustress and distress, they basically all break down into 3 categories: physical, emotional, and chemical. And as you can see by this diagram, each one of those stressors can take up about 1/3 of our total stress. What you could also see by this diagram is that they each interact with one another. In other words, chemical stressors can create physical stressors, and physical stressors can create emotional stressors. Again, positive or negative. One example of that might be exercise. We all know that exercise, right? Exercise is a stress. It causes a change in our body. Assuming it's the right type, the right amount, and the right intensity of exercise, The understanding is that stress should leave us healthier as a result of doing it. And for those of you, how many exercise in this room? Show of hands. For those of you who exercise, how many of you emotionally feel better as a result of that exercise? Of course. So here's a physical stressor, positive one. And as a result of putting your body through this positive stress, you're also creating a positive emotional stress. So you could see how those interact. On the negative side, you could also understand that, let's say potato chips, that's one of my weaknesses. So I could eat a whole bag of potato chips. That would probably be a negative chemical stress for me. And as a result of me eating that bag of potato chips, I could just feel bloated and awful, right? So that chemical stress created a physical stress. And then as I feel bloated and just lethargic and I don't feel well physically, then I start to beat myself up and I start to say, God, why are you so stupid? You shouldn't have done that. You know better. Why'd you eat a whole bag of potato chips? And so now I'm creating an emotional stress based on those other two. And so you understand the interaction? And so I believe that we need to get a really strong handle on this connection, understanding the two types of stressors, understanding the three sources of stress in our life, and then understanding how we can start to manipulate those stressors so that we can create a pattern in our life that builds our health rather than detracts from our health. And so what I do, I have this conversation with patients every day. I have them list out the sources of their physical, their chemical, and their emotional stressors. Then we break those stressors into two more categories: things I control and things I don't control. Because ultimately, I find that a lot of our patients, a lot of us, focus a great deal of attention on things we don't control. And when we put a lot of thought and effort into things that we have no control over, it's very difficult to try to make changes. However, when we think and we put our mind and our efforts into things that we actually have control over, we become productive. We start to feel as though we're making progress. And when we feel like we're making progress and we feel like we're productive, it diminishes the level of stress that thing is causing in our life. And so we break it down into things I control, things I do not control. We try to set aside the things we don't, and we try to focus our efforts on the things that we do. Also, I believe that as a doctor is Latin for teacher. It's our job to educate our patients, one, on this paradigm, so that they understand the influence that their lifestyle, the influence that these stressors are having on their life today and on their health tomorrow. I also believe that once we have a plan in place for having to deal with the stressors we do control, we need to start to offer them a variety of solutions and a variety of tools that'll help offset the stressors that they do not control. Because ultimately those are real, and those are also creating a negative impact in their life. And so we need to have solutions for our patients to be able to offset the consequences of the stressors that we do not have control over. And there are a variety. You could use infrared light, you could use nutritional therapies, you could use peptide therapies, stem cells, hormones, hyperbaric oxygen. And so we're going to start talking about hyperbaric oxygen and how that fits in the model. These are a handful of the diseases that are probably some of the most common that we see in our office. Heart disease, stroke, diabetes, cancer, depression, anxiety, right? So these are all very common conditions that we see in our office. And can anyone tell me, over the last 30 years, what are the rates of these illnesses? Are they steady? Are they going up? Right. I mean, in the last 30 years, but in particularly the last 10 or 15, the majority of chronic illness in the US has skyrocketed. And so we need to be able to handle this. And it's through that stress conversation that I believe we could start to impact our own lives. And then through that, be able to help patients impact their own lives. I want to talk about this last piece before we get into hyperbaric oxygen. This is the pillars that I call the pillars of chronic illness, or the pillars of chronic stress. And it's not that every condition has every one of these, and it's not that it goes in this particular order every time, but I think when you see this organized this way, you'll start to see how the majority of those conditions we were just talking about stem ultimately from these pillars. And so we have hypoperfusion and decreased blood flow. We get gastrointestinal inflammation. We get neuroinflammation, right? Brain and nervous system inflammation. We get autonomic imbalances between our sympathetic and our parasympathetic systems. We get metabolic dysfunction. We get immune system dysfunction. Again, a lot of what goes on in our gut and our energy systems from all that inflammation coming down. Then we get an increase in oxidative stress and reactive oxygen species, both creating another inflammatory cascade. And then ultimately that becomes DNA or epigenetic damage, and that'll ultimately lead to tissue damage. And so these pillars of chronic illness and pillars of chronic stress, these are the conditions, these are the causes. This is what I meant when I said we need to be doctors of cause, not of effects. We need to have tools in our toolbox for our lives, our families, and our patients to be able to handle this category of issue. Let's talk about hyperbaric oxygen. So hyperbaric oxygen is just that. Hyperbaric means increased pressure of oxygen. Okay, what we're really trying to do is we're trying to increase or flood the system with an increased amount of oxygen relative to what you and I can have sitting here in this room. In order to really understand what hyperbaric oxygen does and how it works, I want to talk for a minute about what normal oxygenation is about. You've all either had on your finger or put on your patient's finger a pulse oximeter. And that pulse oximeter tells us how saturated our red blood cells are with oxygen. And for the most part, barring any heart or respiratory illness, no lung damage or anything like this, we all sit at about 98 to 100% oxygenated. Meaning, we basically have as much oxygen in our body right now as we could ever get in. And we need virtually 100% oxygen every minute of every day, just to have normal everyday functions. Think about that. We have zero storage of oxygen anywhere in our body. We could go months without eating. We can go days, a couple days without having any water. But we can't even go a few minutes without oxygen. Think of the power of that. And we need 100% oxygen every minute of every day just to sit here and listen to this conversation. So I think about oxygen as if it were a nutrient, just like that. Imagine vitamin C as an example. There's a certain amount of vitamin C that if you get less than that, there are massive consequences. For vitamin C, that's called scurvy. Then there's a range of vitamin C that we need basically to perform all the normal functions that vitamin C provides us in our body. And then periodically we may choose to megadose vitamin C. Let's say we had a cold. So we choose a period of time where we're going to take a large amount of vitamin C, much more than what's needed in a given day, because that excess vitamin C is going to help us fight that cold. And so why would oxygen be any different? It's a nutrient. If we're not getting a certain amount of oxygen that we need every day, we call that hypoxia. And there's massive consequences to all of our tissue if we don't get that amount of oxygen. Then there's a range. The range for oxygen is very specific. It's about 98 to 100%. We almost need all of the oxygen every day just to provide normal function. And then periodically, we might choose to megadose oxygen because we have a tissue in our body that has suffered some type of damage that requires an increased amount of oxygen in order for that tissue to heal. the thing is this. At 1 atmosphere, in the room that we're sitting in right now, you're already 100% oxygenated. So how could we possibly megadose? You can't get more than 100% saturated. Where does that megadose come from? The only method we have to increase oxygen at that level is hyperbaric oxygen. Hyperbaric oxygen works by increasing the amount of oxygen we're exposed to and increasing the amount of pressure that we're exposed to. And by doing that, our body's able to go beyond the 100% saturation. It does that because it's bypassing the red blood cell oxygen carrying capacity completely. And it's actually dissolving the oxygen directly into the plasma of our blood and directly into our tissue. So sure, if you were 98% going into a chamber, you'd become 100%. But then once in there, depending on the pressure and the amount of oxygen, you can get 20, 30, 50, 60% more oxygenated because of the pressure. This process is governed by 2 natural laws. I'm sure you all have heard them. You maybe remember them, you might not. One is called Boyle's Law, and Boyle's Law just simply states that the amount of volume of a gas is inverse to the amount of pressure, meaning if I have a gas, this much gas, and I put pressure on it, I smush that gas, I could make that gas volume smaller. And then Penry's Law, which basically says the more pressure I put on that gas, the smaller I make it, the more pressure I impart on it, the more of that gas I can now dissolve directly into the plasma of our blood, or directly into a liquid. And so those are the 2 principles that govern hyperbaric oxygen medicine. This is just a quick graph that basically shows, you see the 2 white bars are about the same height, and that just says at 1 atmosphere where we have equal amounts of oxygen in our blood. And then in the treated group, that extra hashed area is the amount of excess oxygen that body was able to absorb because of the increase in pressure. At about 4 atmospheres of pressure, which is a lot of pressure, we typically don't go beyond 3 atmospheres, but most of our treatments are even at 1.5 to 2 atmospheres. But at 4 atmospheres, you're roughly absorbing 4 times the amount of oxygen into your system. So this basically fills our plasma, right? The liquid portion of our blood becomes filled with oxygen. We could start to dissolve that extra oxygen directly into the tissues of our body while under pressure. But there's a third way that this affects our tissue. And I'll use a glass of seltzer as an example. At the far end, you'll see that that glass is obviously filled with bubbles. And as time goes on, those bubbles dissipate. The same thing happens to our body under pressure. And so once we're under pressure, we are filled with this excess oxygen, all these extra oxygen bubbles in our body. And then once we leave that pressurized environment, they begin to dissipate over time. What's interesting is as they begin to dissipate, they don't just disappear. They start to affect the tissue that they're floating through as that dissipation occurs. And so as a result, the amount of tissue we can affect through that dissipation of oxygen is about, again, 4 times the distance from the capillary than what we could at normal pressure. And so that's an enormous distance from a capillary that we can gain oxygen to. So especially in a crush injury or a trauma or a lesion that affected blood supply, where it's not getting oxygen to that damaged tissue, this dissipation is an amazing way to be able to affect that tissue much more distant from the blood supply. So let's get into some of the different types of chambers that are available. The first would be in a hospital type setting. There's either monoplace or multiplace. So monoplace, you would just be alone inside of a chamber. In the multiplace, typically that means there's more than one of you. So it's a room, and the whole room is being pressurized. In a hospital setting, typically the monoplace, that whole chamber is usually filled with oxygen. So you're taking pressurized oxygen out of a tank or liquid oxygen, and you're basically filling the chamber and pressurizing the chamber with oxygen itself. In the monoplace, you're filling that chamber with air. So instead of pressurizing it directly with O2, you're actually pressurizing the chamber with room air. So you're taking air out of this room and you're putting it in that room. And you're sticking a lot of air, so you're condensing it, which increases the pressure. And then you see they're wearing a mask. So in this scenario, you're actually just pumping oxygen directly through the mask. So you're still breathing 100% O2, but you're doing it through a mask rather than through the entire chamber being filled with oxygen. In these settings, the regulations, especially in the monoplace where the entire thing is being filled, you can understand that there are restrictions against oxygen tanks because of the amount of oxygen under pressure. There are similar restrictions. You're just taking the pressure out of the tank and you're putting it into the chamber. So there are also many restrictions on healthcare providers providing chambers like this due to the fact of the amount of oxygen and the amount of pressure that those use. Another type, it's still a hard chamber, is a typical monoplace hard chamber like this. This is the one that we have in our office. So more like the multiplace in the hospital setting, this chamber is not being filled with 100% oxygen. This chamber is being filled with air, and then we're pumping oxygen into the chamber via a mask or a hood, something similar to the picture before. As a result, the amount of oxygen you're using is much less, the safety is much higher, and the restrictions are much lower. And so this is a much easier entry into hyperbaric medicine in the office setting. There are also what's called soft chambers. So those first three that I showed you are all hard chambers. They're all capable of going to at least 2, if not 3 or 4 or even 5 atmospheres. So a lot of pressure that those hard chambers can handle. Soft-sided chambers are really not meant for that. They're considered mild hyperbaric chambers. Typically, they only go to about 1.3 atmospheres. It's about 20 feet of underwater pressure. And you do not pump oxygen into these chambers. So these chambers are either filled with air only, or they're filled with air, and then with an oxygen concentrator, which is about 96 to 98% oxygen, you could pump in some extra oxygen. You're just not pumping in the green tank, pure medical oxygen. And you would use different chambers for different people for different problems. So all categories, the soft-sided chambers, the hard chambers, the hard that are air-filled or the hard that are oxygen-filled, they all have a place in hyperbaric medicine. It really just depends on what your clinic is, what types of patients you treat, what kind of issues they have, and how you want to utilize oxygen and hyperbaric oxygen in your practice. So what are the effects? What do we go through as a result of being in a hyperbaric oxygen environment? Let's talk about the short term first. Pretty immediately after being exposed to oxygen, we'll have increased SOD, superoxide dismutase. It's one of the most powerful antioxidants in our body. We'll have an increased rate of oxidative phosphorylation, right? The pathways that make energy inside of our body. The rate, because oxygen is one of the rate limiting components of ATP production. And so as we increase oxygen availability, we increase the mitochondrial's ability to produce that ATP. We have a vasoconstriction, so blood vessels start to constrict. Some people will say, well, isn't that not a good thing? It really depends, but typically, even with that vasoconstriction, it's temporary, but you're increasing pressure, so we're actually increasing blood flow as a result of that vasoconstriction. And we've already absorbed so much more oxygen into the blood vessels that the amount of oxygen exposure to all the tissue is still going to be many times what it would be without the hyperbaric pressure. Hyperbaric oxygen also decreases inflammation. It helps balance our energy production. We get an increase in perfusion, oxygen to the tissue, carbon dioxide out, and we have a decrease in hypoxia. Long term, we see amazing changes. We see immune system regulation. We see epigenetic expression. If you were here for Dr. Harsh's talk yesterday, he talked about 8,101 genes that we've already identified that are positively affected by this increase in oxygen. We get an increased mitochondrial density. So not only, like I said, in the short term, are we going to increase the rate of ATP production because we're increasing the total amount of oxygen available, but we're also increasing the number of mitochondria. Your body senses the fact that we have more oxygen that can be utilized, and so we start to replicate our mitochondria to become more efficient users of that oxygen. Hyperbaric oxygen is amazing at wound healing and angiogenesis, increased blood vessel building. So we actually start to not only increase the oxygen in the blood vessels we have, we actually begin to increase the number of blood vessels. We build more roads to be able to get more blood and more oxygen to this tissue. There's an enormous stem cell release. That stem cell release happens in our bone marrow, but it also happens in our central nervous system. So for all of our brain injured patients, this stem cell release is extraordinary. It also helps to kill anaerobic infections. What's interesting about the oxygen environment, whether it's in our gut, in our immune system, most good bacteria, right, the probiotic that live in our microbiome, are aerobes, meaning in order for that bacteria to thrive and do well, it needs oxygen to live. And the majority of our pathogens, the bacteria that live in our body that actually hurt us, are anaerobes. They live without oxygen. And so as a result of being in this hyperbaric environment, you're actually feeding and fueling the bacteria that you want in your body, while at the same time making it very uncomfortable and killing the pathogens, the bad bacteria that actually hurt us. And so the immune regulation and the gut regulation that occur inside the hyperbaric environment is extraordinary. I want to show you this. We started today talking about chronic inflammation, chronic illness. And we're moving into hyperbaric and how it works and why I use it in my clinic and why I think it's such a fabulous tool. But look at this. With chronic stress, with chronic illness, we have decreased blood flow. In the hyperbaric chamber, we have increased blood flow. With chronic illness, we have increased inflammation. With hyperbaric oxygen, we have decreased inflammation. With chronic illness, we have metabolic malfunctions, metabolic dysregulation. Inside the hyperbaric chamber, we have increased mitochondrial density and efficiency, metabolic improvements. With chronic illness, we have immune system dysregulation. In the hyperbaric, we have immune system stability. Out in chronic illness, we have an increase in oxidative stress. In the hyperbaric, we have a decrease in oxidative stress. In chronic illness, we have an increase in DNA and epigenetic damage. Inside the hyperbaric chamber, we have DNA and epigenetic healing. With chronic illness, we have tissue breakdown, and with hyperbaric oxygen, we have tissue regeneration. This tool is an amazing tool for helping us deal with chronic illness in our own lives and in our patients' lives. What are people using hyperbaric for? There's a multitude. These are the technically insurance-covered indications for hyperbaric.